First thing I would do, you do a blood work. You have to get a very, very comprehensive analysis of all macro and micronutrients, metabolites in your blood. You have to see, the blood tells us a lot about the general health of the person. You have to see what's in the zone of health and what might be out of the zone of health. So once we make that determination, and again, many people with cancer who come to be treated also have other issues like type 2 diabetes, hypertension, high blood pressure. They have other markers of unhealth, and we need to know what these markers are. And we have to try to bring these blood markers back in line with something that might be healthy. So, and normally what we do, what I would do, would be a zero carbohydrate diet for about 10 to 14 days. This would be a diet that would meat, fish, small amounts of vegetables, and I would use the glucose ketone index calculator, which we developed here at Boston College, to see how my GKI index goes down, which is the ratio of glucose to ketone bodies. As you stop eating sugar or carbohydrates, blood sugar in the body goes down, and ketone bodies mobilized from fats begin to appear in the bloodstream. And that already starts to make you very healthy and also puts metabolic pressure on the tumor cells. So once I would get into this metabolic zone and follow as you said, the patient now has the power. They know, and I've seen, the problem is healthy people like yourself who look healthy, you can get into these zones very quickly within a 3 or 4 day, 5 day period. The cancer patients have anxiety, and their blood sugar goes up because they have anxiety due to corticosteroid increase makes blood sugar go up. Also, if they've had any treatment at all, any radiation or chemo, it makes your blood sugar go up, and it's very hard to get into the zones of super health when you're being subjected to toxic treatments. So in my case, like you said, I would never start off with any kind of a toxic treatment. I would not start off with a biopsy either, because I know depending on the kind of cancer you have, you can spread the tumor around your body if you stick it. So we would want to not stick the tumor. We would want to see if we could shrink it down first. If it can be shrunken down to a much smaller size, then a surgical debulking or extraction procedure could be used, which would remove the tumor in its entirety. Because we don't want to stick anything and then tell some guy, oh, you have a benign tumor, or you have a malignant tumor. Well, if it were malignant, sticking it could make it much, much worse, spreading it into the lymph nodes and into other organ systems, then making a much more difficult progress to treat, a much more difficult task to treat. So no, I would never do a biopsy. I would shrink it down, and I would follow it with a GKI and non-invasive imaging. I could do liquid biopsy. I could do MRI, PET scans. There's a lot of ways we can look at. And this is what we see in the patients when we treat them with metabolic therapy. The PET scans, the tumor disappears, or it gets small. Everything changes. It's not the same anymore. So you can actually see that. You can see it happening. So and then as you see what's happening, then you make decisions. Do I want to debulk the tumor, or do I want to stay the course and continue to shrink it to see if it goes away? And then we can bring in the glutamine targeting drugs, ambendazole, fenbendazole, 6-deoxynorlucine. Now, I'm a scientist. I have access to buy a lot of these drugs because I have access to buying them. Unfortunately, some of these very powerful drugs are not available to cancer patients for reasons that aren't clear to me, because they're not nearly as toxic as a lot of the things we're using, and they're therapeutically far more powerful. So, but I have access to those, and I believe damn well I'd be using them, and I would be monitoring what goes on, and I would do this as long as I could, as long as I could stay alive doing it, and I would be monitoring the whole platform along with my caregiver. Even though I wrote and worked with the guys writing the protocol, I still want to work with my colleagues that are in the clinic doing this all the time, right? Okay, I treat preclinical things. I could treat myself, and I want my friends to be looking at my blood work, and as a team, we would make decisions together as to what course of action we would take. And I would get the drugs and I would use them, and I would monitor them, and I would look as closely as I can, keeping my GKI down. It's a challenge. And if I were to die from this, despite all the things that I know, at least I know I died from the cancer, not from the poisonous treatment that I would be given by a standard of care by people who have no clue about the biology of the disease they're treating. Again, you have to leave it up to the individual. But if the individual knows what to do and the caregiver has a plan, then what I just said, and we make changes too. It's not one shoe fits all. Some people can't tolerate this or that. So we have to blend what they can tolerate in together to make their life a quality of life. We always have to remember quality of life is important in the management of cancer. We don't want toxicity. We don't want any of these off-target problems. We want to keep that microbiome healthy, the gut healthy, your hair color. You want to keep everything healthy as you can while you slowly degrade the tumor, and that's the strategy that I would do. Oh, absolutely. As much as I would hate to do it, I would do it, but only after the zero carb diet. You have to realize if you're on the second floor and you jump from the second floor to the ground floor, it's not pleasant. You probably will get hurt or break a bone, right? But if you use the stairs, you can get down to the same location a lot easier with a lot less problem. So we do zero carbohydrate diet, allows the body to acclimate itself. And then when you do the water only fasting, you're going down the stairs. You're allowing your body to slowly adapt to this new metabolic reality. But if you try doing cold turkey, not eating, just drink water or something, it ain't pleasant. In fact, it's very hard. Most people will say, I don't want to do this. So you have to do it in the right order, in the right way.